In the personalized external aortic root support operation, a custom-made polymer mesh is used to stabilize the aortic root, primarily in patients with Marfan syndrome. Therefore, it is a total tissue-sparing alternative to root replacement. Since 2004, over 350 patients have been operated. The aim of this presentation is to discuss the clinical outcome of the first 200 cases. Marfan syndrome was the most common indication for surgery, and the majority of patients had a normal ventricular and aortic valve function. One of the most interesting applications of this new technique is to perform PEARS during mitral valve repair surgery in patients with connective tissue disease. Isolated aortic PEARS can typically be performed without the use of cardiopulmonary bypass. In 5 cases, an intraoperative conversion to valve sparing or total root replacement was performed. In 1 case, the procedure was aborted due to coronary injury, and this is the only early death in the entire series. Detailed clinical follow-up was obtained retrospectively for 192 patients, with 1 late death related to PEARS. 3 reoperations were needed for failure to achieve complete mesh coverage at the initial operation. Importantly, no ascending aortic dissections occurred in these patients with nearly 600 years of documented follow-up. External stabilization of the aortic root is known to improve valve function. In patients undergoing PEARS, there appears to be a lasting improvement in valve function in a subset of patients. In conclusion, PEARS is a safe, total tissue-sparing alternative to root replacement in select patients. PEARS prevents aortic dissection, and this is consistent with previous studies indicating that the mesh becomes incorporated histologically and that the support stabilizes root dimensions. Aortic valve function is preserved or even improved by this operation.